This is our first year performance testing bulls here at the Valles Caldera National Preserve. The goal is really to look at evaluating the performance of coming 2-year-old bulls on in a high elevation or high altitude environment. Look at their performance, their gain on 100% grass diet, non-supplemented. Then to also look at their ability to acclimate to the high elevations. Typically, in about 3 weeks, acclimation time is usually enough to be able to do the testing, the PAP testing that we're doing today. And we've had these bulls here on the preserve for 60 days. We're about 8,800 feet here at the pens. Really, the higher in altitude you go, the more accurate the test is. We'll weigh the cattle today. We'll also pull hair follicles that we're going to be using for some DNA analysis, the commercial DNA company. We have one of the world-renowned veterinarians that does this pulmonary arterial pressure test, Tim Holt from Colorado State University.
Yeah.
We're taking a needle and putting it into the jugular vein, and I take it's a cardiac catheter, and I actually put it down through the needle, down through the jugular vein, and I'm feeding it with the flow of blood. And then the catheter will pass down the jugular vein into the right atrium through a valve, goes into the right ventricle, and it spins into the ventricle and comes out another valve into the main pulmonary artery. And that's the artery that connects the heart to the lungs. And so what we're doing in that artery is we are measuring blood pressure, both mean pressure and a systolic and diastolic pressure. Okay. So we're seeing if the cattle are experiencing the vasoconstriction of high altitude disease.
But that's really our goal, is to test these bulls in this environment and then offer the bulls that perform probably the best in this environment, tested well with this PAP test, and offer that top percentage for sale at the conclusion of the grazing season.